Urbanization, the global shift from rural to urban living, is one of the most profound demographic trends of the 21st century. With over half of the world's population now living in cities, urbanization has transformed the social, economic, and environmental fabric of society. But while cities offer unprecedented opportunities for growth and development, they also present unique challenges, especially in the realm of public health. In this video, we explore how urbanization is reshaping global health, with both positive and negative implications. Cities have long been hubs of innovation, education, and economic development. Urbanization has brought about significant improvements in healthcare access, infrastructure, and quality of life. Urban centers often provide better access to medical services, healthcare professionals, and advanced technologies. However, as cities grow rapidly, they also bring new challenges that require careful consideration. How are cities impacting the health of their residents? And what can be done to ensure urbanization leads to better health outcomes? One of the most noticeable effects of urbanization is the rise of non-communicable diseases, NCD. As cities become more populated and lifestyles become more sedentary, there has been a marked increase in chronic health conditions, such as heart disease, diabetes, and obesity. The shift to urban living often means less physical activity, greater reliance on processed foods, and higher levels of stress factors that contribute to the growing prevalence of NCDs. While healthcare systems in cities are better equipped to treat these diseases, prevention remains a critical challenge. Urbanization also contributes to air pollution, a major public health issue. As cities expand, SO2 does traffic congestion, industrial activity, and construction, all of which contribute to elevated levels of pollutants in the air. Prolonged exposure to air pollution has been linked to respiratory diseases, cardiovascular problems, and even neurological disorders. In some of the world's largest cities, air pollution has become a leading cause of premature death. In addressing these issues, urban planning must integrate cleaner technologies, efficient public transportation, and green spaces to protect residents' health. Another significant issue is mental health. While cities provide economic opportunities and access to healthcare, they can also be isolating environments. High population density, noise pollution, limited access to nature, and social inequality contribute to increased stress and anxiety. Mental health problems, including depression, anxiety disorders, and substance abuse, are on the rise in urban populations. Moreover, the urban poor, often living in overcrowded, substandard housing, face even greater risks to their mental well-being. The challenge is to build cities that foster social connection, mental resilience, and overall well-being. In contrast, urbanization can offer greater access to healthcare. The concentration of healthcare facilities, specialized medical professionals, and research institutions in cities often translates into better health outcomes, particularly for those with chronic conditions. Innovations in medical technology, telemedicine, and health policy are more likely to emerge from urban centers, providing both local and global benefits. However, this concentration of resources can also contribute to disparities, with rural populations often left behind in terms of healthcare access. Urbanization also impacts infectious disease transmission. While cities offer advanced medical infrastructure, the density of populations creates conditions that can facilitate the rapid spread of infectious diseases. Diseases such as COVID-19, tuberculosis, and influenza can spread quickly in urban environments due to crowded living conditions, public transportation, and global mobility. However, urban environments also provide the infrastructure necessary for faster disease response, including health surveillance, vaccination programs, and public health campaigns. Ensuring that cities are resilient to outbreaks is critical to improving global health. Beyond the physical and mental health challenges, urbanization has the potential to improve public health infrastructure and health policy. In urban areas, governments have more capacity to implement public health policies, including sanitation programs, vaccination drives, and pollution control measures. Cities are also the ideal place for testing innovative health solutions, from smart healthcare systems to urban farming initiatives that promote food security. With the right investments in infrastructure, cities can become engines for improving global health. Importantly, the effects of urbanization on health are not felt equally. Social determinants of health, such as income, education, and access to resources, play a crucial role in shaping health outcomes in urban areas. Those living in poverty or marginalized communities often face the greatest health risks due to poor housing, inadequate healthcare, and limited access to clean water and sanitation. Addressing urban health inequities requires policies that prioritize the health of all urban residents, particularly the most vulnerable. As we look toward the future, it is clear that urbanization will continue to shape global health in profound ways. The challenge for policymakers, healthcare professionals, and urban planners is to design cities that promote health and well-being for all. By prioritizing sustainable development, addressing environmental challenges, and improving healthcare accessibility, cities can become the foundation of better health outcomes globally. At NACSH, we believe that understanding the relationship between urbanization and health is key to addressing the world's most pressing challenges. Through interdisciplinary dialogue and global collaboration, we can work toward healthier, more resilient cities that benefit all of humanity. Join us in our mission to explore and address the complex issues that shape our future.